Ever find a strange bruise on your leg and wonder, is this just a bruise, or could it be something more serious? It's a question that can quickly spiral into anxiety. After all, bruises and blood clots can both look pretty alarming, with the skin discoloration and sometimes even swelling. But did you know there's a key difference between the two that could save your life? Today, we're breaking down the differences between bruises and blood clots, what causes them, how they look, and most importantly, how to know if you should see a doctor. Section 1. What's going on under the skin? Let's start by looking at what's happening in your body when you get a bruise versus when a blood clot forms. Bruises, also called contusions, happen when tiny blood vessels, called capillaries, burst due to some type of trauma. Maybe you walked into the corner of your bed frame or hit your arm on a countertop. This causes blood to leak into the tissue, creating that familiar blue or purple mark. Blood clots are a bit different. They're made up of blood that has clumped together within a vein or artery. A blood clot usually forms in response to an injury as part of the body's natural healing process, but sometimes clots can form without a clear reason. These can become serious if they travel through the bloodstream to organs like the heart, lungs, or brain, potentially leading to life-threatening conditions. Section 2. Why do they look so similar? Both bruises and blood clots can cause skin discoloration. Bruises, which are essentially surface-level injuries, often show up as red at first, then turn blue, purple, or even black as they heal. Eventually, they might change to yellow or green before fading completely. Blood clots, on the other hand, usually don't change colors in quite the same way. But certain blood clots, like those caused by deep vein thrombosis, DVT, can cause the skin to appear blue or purple, and the area may swell. This is one reason why it's easy to mistake a blood clot for a simple bruise. So, how can you tell which is which? Typically, if you can recall a recent bump or injury, you're probably looking at a bruise. If there's no injury and the area is swelling or feels hot to the touch, it could be a blood clot, especially if it's accompanied by symptoms like deep aching pain or tenderness. Section 3. Symptoms and red flags. Let's go deeper into symptoms, starting with bruises. Bruises can be painful to the touch, but the pain typically fades as the color changes over a week or two. Most bruises will heal on their own without treatment. But blood clots can show a whole range of symptoms depending on where they form. A clot in a deep vein, like in the leg, can lead to significant swelling, warmth, and redness. Blood clots in arteries can restrict blood flow, causing pain and potentially leading to severe conditions, such as stroke. A clot travels to the brain, blocking blood flow. Heart attack. A clot forms in the heart's arteries, restricting oxygen. Pulmonary embolism. A clot travels to the lungs, making it hard to breathe. DVT. Common in the legs, this can cause swelling, redness, and a deep aching pain. The biggest takeaway? Any unusual pain, especially if it's severe or accompanied by warmth and swelling, could signal a clot and calls for immediate medical attention. Section 4. Causes and risk factors. So, why do bruises and blood clots happen in the first place? Let's start with bruises. They're often due to an impact injury, but as we age, the skin becomes thinner and blood vessels become more fragile, making us bruise more easily. Certain medications, like blood thinners, and conditions, such as low platelets, or vitamin deficiencies, can also make bruising more common. Blood clots have a different list of risk factors. They can form due to prolonged sitting, smoking, obesity, or a family history of clotting disorders. Surgery and pregnancy also increase clot risk due to changes in the body's clotting mechanisms. Blood clots can happen to anyone, but knowing the risks can help you be more vigilant about symptoms and encourage a healthy lifestyle that keeps your blood flowing smoothly. Section 5. When to seek help. While most bruises don't require medical care, there are a few red flags you shouldn't ignore. If you have a deep bruise after a serious injury or notice a firm lump under the skin, it's a good idea to have it checked out. Blood clots, however, are more urgent. Seek immediate medical help if you have symptoms like intense pain or swelling, particularly in one leg, red, warm, or tender skin near the clot site, shortness of breath, chest pain, or sudden trouble breathing, potential signs of a pulmonary embolism. Even if it's just a suspicion, when it comes to blood clots, it's better to be safe than sorry. Section 6. Prevention and treatment. Luckily, there are steps you can take to prevent both bruises and blood clots. Protect yourself by wearing protective gear during activities, staying active, and avoiding prolonged sitting or lying down. If you're at risk for clots, talk to your doctor about preventive measures like compression stockings, medications, or lifestyle changes. If you have a bruise, simple home remedies can help, such as applying ice to reduce swelling and switching to a warm compress after a couple of days to improve blood flow. For blood clots, treatments may include blood thinners or clot-busting medications, depending on the clot's severity and location. If a clot forms in a critical area like the brain or heart, doctors may perform surgery to remove it. These treatments can be life-saving, so it's crucial to act fast if you suspect a blood clot. Conclusion. So, how can you spot the difference between a bruise and a blood clot? It really boils down to paying attention to symptoms and knowing your body. A bruise from a bumper fall might change colors and fade over time, while a blood clot could come with pain, warmth, and serious complications. By understanding the signs, you can take control of your health and potentially catch a serious problem before it gets worse. And remember, if you ever have doubts, trust your instincts and see a doctor. The peace of mind is always worth it. Subscribe for more health tips, and stay informed to keep yourself and your loved ones safe. Knowledge is the first step to prevention. Stay vigilant, stay healthy.